75-year-old Joe Kella loves being active, especially on the golf course.
I was playing golf 3 times a week.
Yard work is another favorite pastime.
I was just a busybody around the house.
But that all changed in March 2024.
I just had no energy.
One routine doctor's visit revealed something serious, news Kella never expected.
How did this happen? Why did this happen?
We were all pretty shocked.
Kella had been monitoring his PSA levels for years.
I would go and regularly get checked, as most males do, when you get a blood test for a PSA level. And my PSA level over the years had been creeping up slowly.
A biopsy confirmed it, prostate cancer.
The level of cancer I had in those 4 core samples was pretty low. They graded them on what's called a Gleason score. My Gleason score is pretty low, it was a 7.
He then decided to go through brachytherapy.
And that's where they put radioactive seeds in your prostate. And the radioactive seeds kill the cancer in your prostate.
Nearly 8 weeks later, doctors told him he was cancer-free until November.
I was out walking and I thought I pulled a hamstring muscle.
But the pain didn't go away. A trip to the hospital revealed the cancer had returned and spread.
It came back very bad. I had cancer everywhere, in my hips, my pelvis, 3 vertebrae, 4 lymph nodes, spot of my skull, base of my skull, and a pulmonary one of my lung. And at first the doctors didn't think it was prostate cancer, they thought it was something else, because they couldn't believe it happened that quickly and it had just been fixed.
Support from family became his lifeline. His wife, Pamela Callis, says they helped him stay on top of medications.
We had notebooks to chart everything that we ate and did so that we could make sure that he didn't miss medication or if he needed to take medication with food.
Christine Brennick, an oncology outreach manager with Cone Health, says lifestyle plays a role in prevention and recovery.
There's more than 3.5 million prostate cancer survivors that are in the United States alone. So if we find it early enough, there's so much we can do for prostate cancer now. It's came such a long ways.
Joe Kella went through 4 rounds of chemotherapy. His last treatment was 4 months ago.
Every day I get a little bit better. It takes a long time for the chemotherapy to get out of your body, though, also.
As of now, he is still living with prostate cancer and continues to see his doctors. But he's back to doing his favorite activities and taking things one day at a time.
And of course, we wish him the very best. You know, prostate cancer is the most common kind of cancer among men. So that's why we have Dr. Theodore Manny, a urologist in the Triad, member of the Cone Health medical staff, joining us to continue this conversation. Let's talk about a free event, right, that could save some lives?
Yeah, so there actually is a screening event coming up a week from tomorrow on Tuesday, the 23rd. That's being done actually at the Cone Women's Center. And that's a free screening for men age 45 to 70, right here in Greensboro on 3rd Street, with the Cone Health Group.
Okay, so all the guys at home, we're talking to you, all the women at home who have a man in their life, this is something that you need to make sure that they put on their calendar. Let's talk about some risk factors and how they increase a man's risk of prostate cancer.
Sure. The 2 biggest risk factors are going to be race and family history. Those African-American men have a much higher incidence of prostate cancer. It's over twice as likely. Not only that, prostate cancer tends to be more aggressive in those who are African-American, being fatal over twice as often. So race is a big risk factor. The other is family history. Those who have a relative with prostate cancer, a brother, uncle, father, are also at increased risk. So race and family history are the 2 biggest risk factors.
Okay, so knowing that, when should men consider getting screened for prostate cancer or to talk with a health care provider about it? Is it a certain age, or is this some kind of conversation that you should be having with your doctor all the time?
It's a great question. So it is age specific. Men who are in that higher risk category, again, African American or family history, we recommend screening at about age 40 to 45. Those who don't have that strong of a history, age 50. So age 50 for most men, age 45 for those who are African American or have a family history.
Okay, so and screening is the best way to find it?
Correct. We want to find these when they're not symptomatic. That's really our best chance for cure, and screening allows that. Screening is simple. A simple blood test and exam. It's pain-free, very easy, and it saves lives.
Okay, and so we're going to go back again to this free event that you guys have because we want you to be able to go or to tell your loved one to go. Who's eligible and how do you register for this event?
So who's eligible is really any man age 45 to 70 is certainly welcome at the event. Registration is required. We recommend actually calling ahead. The number for that's going to be 336-832-0849. That's in the Cone Health System, again at 832-0849 to call ahead and register for the event.
Okay, we're going to try and get that number up in the next segment just so that people can get it and not be wondering how they register. We want them to have that information. In the meantime, what are the signs or symptoms of prostate cancer that men should be aware of?
Right. Well, again, we want to find it when it's hopefully not even symptomatic at all with screening. But when symptoms do occur, it tends to be changes in urination or bone pain. Changes in urination may be blood in the urine, a lot of difficulty passing urine, urgency, frequency, and again, bone pain. When prostate cancer spreads, it likes to attack our bones, and sometimes unexplained bone pain can be a sign of disease that spread other places.
Yeah, in that story that we just showed, he thought he had like a pulled hamstring or something like that from playing golf.
Exactly. We see that from time to time, where an unexplained bone pain can actually be a sign of prostate cancer that spread. But fortunately, most of the time it's found when we don't have symptoms at all.
All right. Now, for men who, put off going to the doctor, how concerning is that with respect to prostate cancer?
Well, it is concerning. When the disease is spread other places, it unfortunately cannot be cured, but it can be controlled, such that it still may never take a day off of a man's life. So it's concerning when there's symptoms, but it's not the end of the world. The treatments have advanced so far where we can even put things in a very good controlled state for those cancers that have spread other places.
Let's talk about this. Does an elevated PSA level always mean that there is cancer?
Fortunately not. The PSA blood test, which is a part of prostate screening, is good, but it's not perfect. There are lots of false alarms. Other things can make it go up. A recent infection, or even just a really large non-cancerous prostate can make it elevate. So that one elevated PSA, concern, but not alarm.
Okay, and so that means if your loved one goes and gets that elevated thing, you don't have to automatically jump to the conclusion that something is wrong, but it is something that you should be taking a look at. All right, what kind of steps can men take to lower their risk of prostate cancer?
So prostate cancer, unlike lung cancer, for instance, is not as responsive to lifestyle changes as other ones. But that being said, smoking does influence it some, so smoking cessation can lower our risk. And also, we want to make sure that we're having alcohol in moderation, less than 2 drinks a day. Alcohol in very high concentrations can also increase our risk of prostate cancer some as well.
Okay. All right. And then let's talk about some common misconceptions, because I'm sure that there are plenty of them out there. Maybe your top 3 out of the top 100 that you know. What are some common misconceptions about that you want to address?
Sure. I think the biggest one now is that one misconception is that prostate cancer only happens to much older men. That's just not true. We're seeing a trend in all sorts of cancers towards more aggressive disease at a younger age. And we're seeing men in their 40s unfortunately show up with pretty aggressive disease. So prostate cancer, it's a disease of middle age and older men too, not just older men. That's the first biggest misconception. The other is that if a man's diagnosed with prostate cancer, it always means that some sort of terrible treatment is necessary. That's not true. Treatments have become much more streamlined with time, and a lot of men actually monitoring is a great way to manage things. So that's another big misconception, is that a diagnosis automatically means that things are going to be unpleasant. That's just not true.
All right. Well, you did mention that treatments have changed compared to years past. So what kinds of treatments are we talking about?
Sure. So one of the biggest changes in our field in the last 20 to 30 years has been a concept called active surveillance. And this is for the man who has the smaller, less aggressive cancer. We've gotten better at as a field at identifying ones that really shouldn't be treated and just monitored alone, such that now about 50% of men who are diagnosed with prostate cancer actually just have monitoring. And for those who have more aggressive disease that do need treatment, surgery and radiation are both great options, and the technologies are always improving, with side effects becoming less and the invasiveness becoming less every year.
Yeah, we all like to hear that. I'm going to ask about your final thoughts, but I do want to ask this because I want you to talk to all the men out there who don't like to go to the doctor.
Well, I don't blame you. I can be one of them too at times. But the biggest message is screening saves lives. Since the introduction of the PSA blood tests, the cases of metastatic prostate cancer have actually decreased 70%. So, for the ladies out there, encourage that man in your life to get screened. And for the men out there, it's okay to do. It saves lives, maybe even your own.
Okay, and when we talk about this free screening event that's in a couple of weeks on that September 23rd, what happens during that screening time? Like what will men be asked to do and how long will it take and that kind of thing?
It'll be very quick. It'll be a simple blood test that's looking again for that PSA level, which is an important part of screening, and then some history and just a quick exam. I imagine it would take less than 5 minutes. It'll be quick.
Okay, all right. So we want you to be able to register for that. We've got the number that's on the screen right now at the bottom, 336-832-0849. It is free to go to this screening event, but you do need to register so that they make sure that they have all of the resources and things that you need. Thank you. We so appreciate your time and expertise. If you want to see this interview again, maybe you need to send it to a loved one who needs to hear about this. It'll be in the To Your Wellbeing section